Hi, I'm Bruce Sands. I'm Chief of the Division of Gastroenterology at Mount Sinai in New York. And I'm going to tell you about the SEAVUE study, which was published in the June 11th, 2022 issue of Lancet. SEAVUE was a very interesting study that compared head-to-head two biologic therapies widely used to treat Crohn's disease. These are ustekinumab, which blocks IL-12 and 23, and adalimumab, which is the most widely used anti-TNF antibody. The hypothesis of the study was that ustekinumab would have superior efficacy when compared in a blinded fashion to adalimumab. The study was very simple in its construct. Essentially, the design was that patients were randomized if they had moderate to severe disease and were essentially biologic naive patients to get either ustekinumab with a standard loading dose followed by every 8-week subcutaneous injection, which is the standard dosing that's used. And the other arm was randomized to loading dose of adalimumab and then 40 milligrams subcutaneously every 2 weeks. Again, standard dosing for that medication. Patients were followed out to week 52, and the primary endpoint of the study was clinical remission as defined by a CDAI score less than 150 at that time point. And there were a number of secondary endpoints examined as well. The patients had moderate to severe active Crohn's disease. And to make a long story short, the study did not achieve its primary endpoint, which was intended to show superiority of ustekinumab. 64.9% of patients achieved clinical remission at week 52 with ustekinumab compared to 61% with adalimumab. So in a sense, this was a negative study. However, it was interesting to note that many patients actually did achieve this endpoint of clinical remission out at 1 year. And this was higher for both drugs than we expected going into the study. And that may be because these are relatively early in their disease course patients. A number of secondary endpoints were also examined, and I think the key ones really include endoscopic outcomes, which seem to suggest that ustekinumab was slightly superior to adalimumab in achieving, for example, an SES-CD score, which changed from baseline at a higher percentage and mean with ustekinumab as compared to adalimumab. In addition, the durability of therapy, time on therapy, was longer for the patients with ustekinumab. And from other work, we know that ustekinumab is an extremely safe molecule with infection risk and cancer risk very similar to placebo, whereas the anti-TNF antibodies, such as adalimumab, we know have risks of infection and potentially lymphoma and other serious adverse events. So in all, this was an interesting study. We think it shows that either medication is a reasonable choice for patients who are naive to biologic therapies, and that high rates of clinical remission can be achieved at 1 year. Whether you would choose one drug or the other for a specific patient probably has a lot to do with how they value convenience of dosing and the safety profiles of the medications. So hopefully you found this interesting, and thanks for your attention.